And welcome back. Well, the leading cause of death in America is not cancer or gun violence, but in fact, it's coronary artery disease. That's right. This is when fatty materials build up in the arteries of the heart, and for some, the passageway for blood becomes completely blocked. So here with Aurora Cardiac Services to talk about a new treatment option is Dr. Anjay Gupta, along with one of his patients, Thomas Piraleski. Welcome to the Morning Blend, both of you.
Hello.
Thank you.
Thanks for being here. I think some people will say, well, that's shocking. You know, we hear so much about cancer. We hear so much about a lot of diseases and things that may be genetic or we can't do as much about to prevent, but coronary artery disease is the #1 killer. What exactly is it? I kind of mentioned a little bit about what it is, but how does it come about?
So you get blockages which builds up in the heart arteries because of deposition of cholesterol, and usually patients who have high blood sugars, high cholesterol, high blood pressure, and if they're genetically predisposed to it, they develop the blockages, and that's what causes the narrowing of the arteries.
So we hear a lot about cholesterol when you think of things like eggs or butters or dairy, you know, things like that. Are those the bad guys, or are they okay?
That's usually the bad things. You have to really watch what you eat. Also, the other important thing is to watch the carbohydrates in the diet, like rice, pasta, spaghetti, potatoes, ice cream, because a lot of that extra gets converted into cholesterol in the liver. So along with avoiding fatty foods, I think it's very important to avoid the carbohydrates in the diet also.
Okay, so the carbs are kind of one of those weapons of destruction against our arteries.
Right.
Good to know. So people with, if somebody's been told, you know what, you have coronary artery disease, does it always progress to the stage of being what's called chronic total occlusion?
If it's untreated, then it progresses with time, and if it's not picked up at a very early period of time and taken care of, and if you don't control the risk factors, then it progresses with time and goes to completely block the arteries. That's when we call it the chronic total occlusion.
Will you find out about that before a stroke or a heart attack?
Usually, if the cholesterol plaque ruptures suddenly, it forms a blood clot and that causes the heart attack. But sometimes in a lot of patients, we see that it progresses with time silently. Patient may or may not have symptoms till to the fact that it really completely blocks the artery, and then the patient starts experiencing more symptoms like shortness of breath or chest pain when the heart doesn't get blood flow.
Did you have any of those symptoms?
Yes, and it came on real quick within a couple of weeks before I had the severe chest pains and shortness of breath.
So it wasn't this slow progression of symptoms?
Not in my case, it wasn't, no.
Is that typical?
It can present both ways. In Tom's case, what happened was he had an artery on the right side of his heart which was 100% plugged up, and there was an artery in the front which actually had a plaque buildup which was gradually progressing, and in that plaque ruptured, and that started forming a blood clot, and that's why he had rapid progression of symptoms. And because that artery was supplying blood to the artery on the right, he had more symptoms than usual. So.
And you're a thin, fit guy.
I watched my diet, I exercise, you know, it's just one of those things. So.
Yeah, it's just one of those things that sort of happened. Is that I mean, people might say, you know, hey, I run, or I bike, or I swim, or I go out and I walk, or I garden. Are those enough, or is there a genetic component?
There is a very strong genetic component to it, and that's why even if you exercise, eat healthy, it does help to a certain extent, but if you're genetically predisposed to it, you can still have the blockages and the symptoms.
And you guys created an entire program around the CTO, the Chronic Total Occlusion. So talk about the crossbow device, and exactly that's what you used as well on Tom, correct?
Right. It's a special device which has been newly approved by Food and Drug Administration. What we do is with the device, it's like a little spring tip device which we kind of drill through the chronic occlusions, which is full of old calcium and old blood clot. And in Tom's case, you can see the pictures over there that the artery on the right side was 100% occluded, so we were able to get through with the device, and then we balloon the area open, and then we put a stent in, and of course this is the picture of the balloon going up inside that blockage, and that then subsequently put a stent which is like a little metal mesh which acts like a scaffold to keep the artery open, so and that establishes the blood flow. Exactly, it gets lined by the normal lining of the blood vessel, becomes part of the body. So here in the picture you can see the before and after pictures of the Tom's artery on the right side, and it looked really good.
And for you, Tom, you know, you said how you were kind of having some of those symptoms before. How do you feel now after the procedure?
Great. I mean, it's unbelievable. It's I I resumed all the activities I've done in the past. So.
No shortness of breath,
None,
no chest pains.
Nope, nothing.
Well, I think it's good that that you recognize those symptoms and that you went to a doctor, because I could see a lot of people saying, "Oh, I'm having this, but maybe it's no big deal." And I would assume that you really encourage people, especially if it's a new symptom, to come and see a doctor.
Absolutely. I think you should ask for help and you should see a doctor. It's very, very important not to ignore those symptoms, because that's how people end up having acute heart attacks and die suddenly. So I think it's very important to ask for help.
Well, we're glad that didn't happen to you.
I am too.
So resume your active lifestyle. You feel great. I think that's it's a really good testimony, just to know that you went in and had the procedure and feel really great and can do everything that you did before.
Yeah, I'm ecstatic about it.
That's wonderful. I want to make sure everybody has the information for Aurora so that you can contact, especially if you've had some symptoms. Don't hesitate. If you've had the shortness of breath, if you've had pain in your chest, contact the cardiovascular services. It's a toll-free number for Aurora Healthcare at 800-640-1989. Thanks so much for being here, both of you.
Thank you.
Thank you.
Yeah, happy Father's Day to you guys.
Thank you.